The World Health Organization says it could still take some time to get a full picture of the threat posed by Omicron, a new variant of the coronavirus, as scientists worldwide scramble to assess its multiple mutations. At least 69 countries and territories have imposed travel restrictions in response to the spreading Omicron variant. Portugal detected 13 cases linked to the new variant among members of a single soccer club, only one of whom had recently traveled to South Africa. The variant appears to have a high number of mutations, about 30, in the coronavirus spike protein, which could affect how easily it spreads to people. From just over 200 new confirmed cases per day in recent weeks, South Africa saw the number of new daily cases rocket to more than 3,200 on Saturday, most in Gauteng, the country's most populous province.
The Omicron variant has more than 30 mutations in that spike protein, and some of these mutations are ones that we've seen with highly transmissible variants like the Delta variant, and some of these mutations are ones we've seen with variants that have shown some immune escape, like the earlier Beta variant. And then there are 24 or so variants that are really unique to this virus. But it's that combination of potential increased transmissibility and potential ability to escape our immune system that has everyone worried. We don't know what level of neutralizing antibodies might be protective against the Omicron variant. But kind of based on our experience with prior variants, so for example, let's say the Delta variant, we know that higher levels of antibodies and the vaccines that we use are really based on the original strain that was identified in Wuhan. We just know in general that higher levels of neutralizing antibodies are protective across different variants. Whether that's going to hold true with Omicron, we do not yet know. I think there's reason to believe that there'll certainly be some protection conferred. I think this certainly needs to be taken seriously, but as the president said, I don't think we need to panic yet because there's still so much to know. But we can't wait 2 or 3 weeks to put things in place. We need to start getting ready now, and it has to be much more than travel restrictions. Those are going to have minimal impact at best, and may delay the entry of the virus, or have fewer importations, at least in the short term, of the Omicron variant. But it gives us perhaps a short window of time, a week or so, to really be prepared.
Joining us now from South Africa is Dr. Mthembeni Tebelele, a medical doctor with an MBA in leadership from the University of Liverpool, an experienced HIV clinician and a member of the SA HIV Clinician Society, a certified life coach and a member of Coaches and Mentors of South Africa. Good morning, Dr. Tebelele, and thank you very much for joining us on the morning show. Well, Omicron variant. I'd like to ask you, what is being done to contain the spread of the Omicron variant in South Africa? What do we know about the efforts of government, and what's your own assessment?
Good morning, and thank you for inviting me at Arise News. As you know, in South Africa, the main issue is vaccination. We are pushing very hard, and the government is pushing very hard through NGOs, through all efforts to make sure that everyone gets vaccinated, knowing that vaccination improves outcomes in terms of the disease not getting worse and also people not getting to hospital. So vaccination is the main issue that the government is actually driving, and also pushing people to adhere to sanitizing, to using a mask, and also keeping social distancing. So health education is the main thing, but we need to push more, and the government is actually pushing more people to actually vaccinate. Vaccination is the main thing, noting that the percentage of people who have vaccinated in South Africa is still very low at about 35%. So we still need more people to be vaccinated. That is where the government is actually pushing, and as private sector and as NGOs, we are assisting in pushing more people to vaccinate.
How exactly is the government trying to push the vaccinations at this time? Is it through public enlightenment? Can you expand on that? And also, are lockdowns and other, social controls being contemplated at this time, social restraints?
Thank you very much, Ozzy. Currently, the government is pushing for more sites. There are more vaccination sites, and there's a program that has recently been launched in November, which is called VUMA. VUMA vaccination is more like a public campaign to encourage the public and in various sites and various provinces in South Africa for more people to vaccinate, to increase the uptake of the vaccine. And also radio stations and TVs are used to actually disseminate information and keep people updated. For example, the president was addressing the nation 2 days ago about the issue of the new variant and what needs to be done. And the fact that South Africans have been barred in traveling to so many other countries, keeping people informed and enforcing the current measures of sanitization, vaccination, and also social distancing, and the VUMA vaccination campaign. That is actually the hype that is created to make sure that a lot of us, a lot of the public are aware that COVID will revolve around us unless we push more people to have antibodies against the virus.
What should be done as regards, this mentality in the West that is going round that it is an African variant? Because that's what a lot of them are saying. And in effect, what they should be doing is to thank Africa for helping the world to sequence a variant that has been in the world, pretty much. So what can we do, to dispel this terrible mentality, this shameful and shambolic mentality being peddled by the West?
You cannot put it worse than that in words. It is actually embarrassing. It is actually discouraging for people to be punished for saying that we have discovered that what is actually driving the COVID numbers currently in our country is not the Delta virus as it was dominant. There's a new strain. For our scientists to be that vigilant, for our scientists to be that transparent, and now to get punished as if this is a SADC thing, this is a Southern African bug, or this is something that is brought to us by Africans, it is something that needs to be spoken against at the West terms. It is unacceptable. It is supposed to be actually applauded that the South African scientists actually came out and said there's a new variant that is driving the numbers. And actually, if you look at how many countries came to declare after South Africa had actually come, there are about 17 countries, if not more, that have actually confirmed to have cases of the Omicron variant currently. So it's just South Africa was the first one to pronounce on it. Why should we be punished as Africans? Why should we be barred from traveling instead of keeping the measures that were already in place to make sure that people do screen before they visit any country? And then if there's suspicion or symptoms, people get quarantined like anywhere else instead of barring Africans from traveling to other countries. It's like now some people who've got leprosy and that don't come here are going to contaminate us. That is unfair and it is uncalled for, and it is supposed to be immediately lifted so that people don't get scared to actually say there's a new bug that is driving the new surge of COVID now. For instance, what would have happened if the South African scientists had not declared that there's a new variant, Omicron, that is driving the new numbers in South Africa? So it means the world would fold numbers, because once you come out first, it means you get tagged and gagged that okay, the virus seems to be more there. Let those people not come to our country. That is unfair. That is unacceptable. For example, Botswana has got more cases, then South Africa has got more cases, but even Italy and Rome have got cases also.
Well, Doctor, well, we're still waiting for scientists to come up with a definitive statement on the, transmissibility of Omicron. How much of a big risk do you think this poses to African countries that are far behind, and even maybe, low and middle income countries generally that are far behind in the vaccination process? Now that we've been told that, look, the solution is to ramp up vaccination. And you have countries like the US, like the UK, already talking about booster jabs. The UK has even lowered the bar. It has reduced the months. It has reduced the age of eligibility. Where does that leave African countries, that do not even have up to 10% of their populations vaccinated and have challenges of access to syringes, access to vaccine supply, and except South Africa, most of these countries cannot even develop the capacity to manufacture vaccines. What should be the policy options?
That's a very realistic and a very realistic and painful question that you are actually raising. That Africa is a resource-limited setting. We don't get, for example, if you look at the first 12 countries, they bought so many vaccines. We had to wait for them even before we could access the vaccines as Africans. And then even in Africa, the countries that have got the financial muscle to source the vaccine, they are inequitable. They are not equal. They cannot access the vaccine at the same pace as the first 12 countries. So should we be punished for that? Instead, I think the first world countries should actually look more into how can we make sure that the whole world is vaccinated. Donate vaccines, donate resources, donate syringes and needles to African countries because our problem is their problem. It's like if you are sick or if you are healthy, you are as healthy as your neighbor. If you are sick, you are as sick as your neighbor. You cannot be healthy if your neighbor is sick. So they need to plant more resources into Africa and make sure that they assist that they do not become selfish and vaccinate maybe 100% of their population, whereas about 10% of some African countries only have access to the vaccine. So there are politics involved, even on top of the science.
Always. And really, that leads me just to comment on the folly of vaccine nationalism and another sort of folly that emerged right from the outset of this pandemic. And I really hate to ask you, but I must. Already, the Omicron variant is being politicized, as you said, and also the infodemic is affecting that as well. There are people saying it's fabricated. There are people saying it's a hoax. How would you respond to those people saying that about the Omicron variant?
The reason there are myths around these variants is because people don't understand epidemiology. People don't understand the scientific predictions. I'm a medical scientist. I'm someone who's grounded in medical science. I'm not into politics, so I understand viruses do mutate. But what has actually misled people or actually made people to be sarcastic or have this myths revolving around is lack of understanding of the predictions, how epidemiology works and so on. But all viruses do mutate. And the nice thing is that epidemiologists do have models that predict when are these likely to happen. So it's like prophecy in people who do not know modeling. So as far as I'm concerned, the issue of variants coming, this is not the first variant. There is Delta, there's Gamma, there's Beta, there's other many variants of concern and variants of interest which have come out of the original COVID. And like any other virus, even flu virus, they do mutate. So even myself sitting here, I can say the flu virus next year in 2022 will be different from what we had, the strain that we had this year. That is the nature of viruses, but we need to educate people and to minimize the hoax and myths. As far as the origin of the virus is concerned, there are a lot of theories and so on, but what we need to deal with now is that the virus is here and what we need to do to minimize spread and to minimize deaths of our people. education will actually help a lot, and dissemination of information, which is the duty of all our government arms to educate our people about viruses, about the importance of preventing new variants from coming out. Because the more we give the virus grounds to plant itself, the more it is likely to actually mutate and give rise to new strains.
Okay. I'd like to ask you about vaccine production in Africa. We're hearing about a certain fill and finish plant coming up in South Africa and some other parts of Africa soon. I mean, what do you know about that? And how quickly will Africa start to churn out its vaccines? I mean, albeit still with intellectual property of the West, but at least made in situ on the African continent.
That revolves around politics also. If you look at, let me just paint a picture of South Africa. The vaccines are not produced locally, but there is hope because where I am, in the Eastern Cape province, there's a big pharmaceutical company called Aspen. They are assisting in bottling and finalizing some of the vaccinations, even though the vaccine is not produced locally, but there is a plant that is assisting with packaging and finalization of bottling and so on, which is hope. But African countries need to invest. We've got the skills. There are so many scientists in Africa and Southern Africa, but we just need resources because to open research labs, to invest on vaccinations, it needs lots of resources, lots of money to be spent on laboratories and research, and that can be done. But money is still an issue. Money is still an issue. So we need resources. The skills are here. That is why even Omicron was actually declared, because South Africa is very vigilant in terms of coding these things and genomic coding of the variants. So if we can plant more resources, get more funding, Africa can still come out tops in terms of catching up on science and doing things on our own as Africans. We are capable, but it's lack of resources that should speak to our governments, that should speak to our politicians to invest more in developing our own countries so that we are self-reliant, we are self-sustaining as Africans in terms of science and also in terms of investing in resources. This is not the first epidemic and this is not the last epidemic. So it means we should actually plant ourselves into developing vaccines in our own countries.
Well,
that needs money.
Well, Dr. Tebelele, yesterday, the President of the United States, made a statement on this. And he said, well, Omicron may be a variant of concern, but we should not panic. And his position was further amplified by Dr. Anthony Fauci. And we get the same kind of message from the United Kingdom. But my concern is about vulnerable countries. Should we panic in Africa, or there's no need to panic?
There should be no need to panic as long as we heed the messages to actually increase uptake of vaccination. We should not panic, but we should do the right thing. We should be very vigilant in doing the right thing. COVID-19 has killed a lot of people. COVID-19 has led to a lot of people being hospitalized. COVID-19 has paralyzed a lot of people. A lot of people are still ailing from long COVID. We should not panic, but we should do the right thing in terms of preventive measures and also encouraging each other to take the vaccine. There are people who got infected with COVID. They've got natural immunity a little bit, and then getting boosters and getting vaccination, and the importance of not being complacent, thinking that this COVID belongs to certain areas and so on. Vigilance and talking about it every day. We should not panic, but keep on doing the right thing. Complacency must never be part of our daily routines.
Well, thank you very much, Dr. Tebelele, for joining us this morning on The Morning Show.